If you're taking methylene blue or considering taking methylene blue, these are the 5 dangers and risks that you cannot ignore because this can be very detrimental to your health. The very first thing that can be very dangerous and risky when you're taking methylene blue is the dosing. A lot of people are confused on how much they should be taking, and then they get great results, and then they take more and more, and they increase the dose. But this is a very risky move. In fact, you really should be talking to your doctor about the dosage, especially with your medical history, because there's certain things that you cannot ignore that can be very detrimental. And so what has been shown that has been really risky is when you exceed about 2 milligrams per kilogram of weight. Because what has been shown when people exceed this, things can happen of having nausea, vomiting, dizziness, headaches, and possibility of hemolysis, which is also very risky with your blood. Especially if you have G6PD deficiency, you definitely don't want to exceed this amount. You definitely should be working with someone if you have that deficiency. Now, what I suggest is if you are taking it or considering taking methylene blue is you need to start very slow. Start a very small dose. I would recommend what the bottle typically would recommend, which is about 10 milligrams a day, and then slowly building it up there and working with a doctor, somebody that can guide you through it, especially with your medical history, to making sure you don't exceed what you should be taking. And really, I would stick between about 0.5 to 1 milligram per kilogram weight as the most, but I don't think that's absolutely necessary. When I was taking it, I really only exceeded about 50 milligrams a day. So really, and I thought that was efficient enough. You don't necessarily need to exceed that. It really is about taking it throughout the day and also doing lower doses throughout a long period of time to get the kind of results that you want. The second dangerous thing when it comes to taking methylene blue is if you are taking an antidepressant, an SSRI, or any kind of medication that is targeted to increase serotonin, methylene blue also inhibits monoamine oxidase, which helps break down serotonin. So it inhibits that process. So what's going to happen? It increases serotonin levels. Also, your SSRI medication and other serotonin medications also do that. So when you're taking methylene blue along with that, it can cause something known as serotonin syndrome, which this leads to agitation, irritation, confusion, can have high fevers, tremors. This is a very dangerous category. It can lead to very serious health conditions, but even in some cases can be very detrimental to the person. So you don't want to ignore this. And this is why you got to be very careful when it comes to mixing different medications and taking things like methylene blue, because that can lead into something very serious. The third very dangerous thing is other medications that methylene blue does interact. Now, we already talked about SSRIs, but there's other medications that you do need to be careful if you are taking these. So for example, if you are taking like Adderall, Ritalin, any kind of stimulant medication, methylene blue does interact with that. It can either increase the effects of it too much, or it can just mess it up where it can cause detrimental effects to your mental health. There's also, if you're taking an opioid, that can also interact with methylene blue, and other antipsychotic medications, even things like Parkinson's disease medications. You don't want to be mixing these two things. If you, for some reason, want to, you definitely need to be talking to some doctor that can be managing this, because this is a very fine line that can make things worse for you. Now, the fourth dangerous thing that you need to be looking out for when you're taking methylene blue, and this usually happens when people are taking too high of a dose. Even when I was talking about the 0.5 to 1 milligram per kilogram weight, sometimes this can even show up where you might be dealing with hypotension or hypertension. So when you're taking it, you need to look at your blood pressure, notice if there's a big change in a dip or a spike. And if there is, you definitely should be talking to your doctor about it, making sure that this isn't an issue for you, and making sure that maybe you're doing too much of a dose, or it may be something that you shouldn't even be taking. Because dealing with low blood pressure or too high blood pressure can be even more damaging to your blood vessels, and it isn't worth the risk of taking something like methylene blue if it's causing those effects on you. Now, the fifth thing you should be looking out for is also the dangers of taking methylene blue. And this also happens where I see it, where people are doing too high of a dose. And that is where it becomes different neurological effects that you might be experiencing. So we talk about confusion and tremors, but there's also some other neurological effects that can happen, where you can feel very restless, but also you can lose your coordination. So if that's happening, it might be because you're doing too much methylene blue, or the methylene blue is causing that effect on you. It also has been known to sometimes cause seizures when people are doing too high of a dose. So this is just something to really keep in mind. Now, a bonus one, this is something to not really be too concerned really at all, is when you do take methylene blue, it will cause your urine to turn blue or turquoise. That's just the effect of it. Just like when you're taking B vitamins, it causes your urine to be very neon yellow or green. So this is the same case with methylene blue. It's nothing to be concerned about. It's just something to look out for. Now, if you want to see my experience of taking methylene blue for 30 days and what my full opinion is on it, then watch this video next where I dive in deep talking about my experience of taking methylene blue for 30 days. So watch this video next.